Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hello, welcome back to the podcast. We are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Abbey McLaughlin, who is a registered nurse and international board-certified lactation consultant. She also joined us with her sidekick, 5-week-old Henry, so if you're someone who melts at the periodic sounds of newborn grunts and squeaks, you're in for a treat. You may hear him in the background just a little bit, and he is so sweet. Abbey is the owner of Mal's Milky Way in Appleton, Wisconsin, and she aims to empower families by providing personalized lactation care and education, allowing them to achieve their feeding goals. Like many members of the Motherhood Alliance, Abbey discovered her calling and established her business after experiencing a challenge for herself, and in her case, it was a traumatic first breastfeeding experience with her first daughter, Mallory. Abbey is a wealth of knowledge regarding all topics related to feeding tiny humans, including breastfeeding, bottle refusal, premature and medically complicated infants, latching and positioning, prenatal education, and so much more. In this 4-part series, we take deep dives into multiple topics, including what does a lactation consultant do and not do in episode 1, liquid gold, the benefits and surprising additional uses of breast milk in episode 2, feeding newborns, what to expect and tips for success in episode 3, and finally, weaning from breast and bottle, when to wean and practical tips for success. Abbey offers multiple programs and packages, as well as a free prenatal consultation for anyone who wants to ask questions and connect with her before baby is born. But I do want to mention a special promo she is offering Motherhood Alliance listeners. You can get $50 off of her life cycle package, which, side note, I would have loved to have this when my kids were little, and I would highly recommend it. But you can get the $50 off her life cycle package by using the code MMW3, all capitals, for the MMW. So MMW3 to take advantage of that special offer. Let's dive into today's conversation with Abbey and baby Henry. Hey everyone, welcome back. We're here with Abbey again. Welcome back, Abbey.
Thank you.
We are excited to talk about liquid gold today. So let's start with that. Why is breast milk called liquid gold?
It is so funny that everyone calls it that, but number one, the first milk colostrum looks like liquid gold. So that's definitely where it comes from. And also it's been scientifically proven time and time again to be the best nutrition for our babies.
So tell us a little bit more about that. So what is breast milk actually made out of?
It's made out of quite a few things, but it's mainly water. And something that I love to share is that, because we're obviously mammals, but our milk has the highest water content out of any mammal on Earth. And we can dive into that more on newborn feeding expectations and why that fact is important. But water is the main content, and then also macronutrients and micronutrients. So you have their fat, protein, and other variables, vitamins, minerals, and antibodies, immune support, which is great.
Well, and from what I remember about breast milk too, is that it actually changes throughout the day too, and based on baby's needs, right? So like sicknesses and everything else as well.
Yes. So that is one thing why it's so important to feed babies breast milk is because it's continually changing. It can change from feed to feed, from morning to night, from day to day, and as our babies grow, which is amazing.
Well, let's talk more about that because that's super interesting. How does it actually change?
So our babies actually communicate with us with their saliva through our nipples, which sounds crazy, but our bodies can respond to that, which is so super cool. So it's like one feeding, they're like, hey, mom, next time I need a little bit more protein or fat. Can you ramp that up? And from feeding to feeding, it would change for them, which is so super cool. And no other food for our infants can do that. So that's really amazing about breast milk. And it changes from morning to night because in the morning we have our highest prolactin levels, which is our milk making hormone. So in the morning, a lot of the pumping moms, especially, or even just the nursing moms, you wake up feeling really full, especially after your baby sleeps like that first really long stretch at night. So you'll notice like, okay, I have a lot more volume in the morning. And then in the evening, a lot of times too, moms are like, why does my baby cluster feed in the evening? Or why do I only pump X amount when in the morning I pump so much more? Because of the difference in that prolactin level. And actually in the evening when we have less volume, it's less water content, which means it's more bang for your buck. So it's higher levels, fat, protein, calories, just to meet their needs for the lack of the volume.
Does what she's eating, does that dictate, how you said it changes during the day? Does that also dictate, levels of protein, fat, or antibodies, anything? Does what her diet is dictate what the milk supply looks like?
Absolutely. And that's same with like pregnancy. So our bodies, obviously, number one, will pull all of our nutrients and give them to our baby. So it does the same for breast milk. But our diets absolutely influence. So moms who have a higher fat protein diet or just have a better well-rounded diet would probably see higher levels in their breast milk. But for majority of moms, no matter your diet, like I said, they'll pull from our sources first and give it to our babies. So even if you're living off fast food, your baby should still hopefully get what they need, right?
Get the good stuff, but then you're going to wonder why you're feeling so fatigued, right?
Correct. Yeah.
There's nothing left for you.
Yep. And we need postpartum healing as well. So eating a well-rounded diet is so super important for our own healing journey.
So what else can you tell us about breast milk? Like short-term benefits, obviously nourishing the baby. Are there any other short-term benefits to know about or long-term benefits?
Absolutely. So we talked about colostrum being that first milk. So colostrum is actually produced from placental hormones. So we start making it around 4 or 5 months in pregnancy, and we will continue to produce it until we birth our placenta, which is so super cool. And that colostrum is really packed full of our baby's first dose of immunity. It's really high in antibodies, and really it has everything they need in just little drops of milk. Because in the first couple days, their bellies are so small. So it needs to be a big punch to get them everything that they need. So that's super cool that it's really their first dose of immunity. And it actually primes their gut for what could be a lifetime. So we all have a microbiome, and there's actually really great bacteria in breast milk as well. So even if you're not planning on breastfeeding, I always say if you are leaking any colostrum after birth, rub it in your baby's cheek. Let's prime their gut with some of that good bacteria, because a lot of studies have been shown like babies who didn't breastfeed at all have higher risk for like IBS or Crohn's and, other GI things like that.
That's so interesting. Random question that I did not have on the list for today is just talking about gut health in general. If an adult is having poor gut health, would it be beneficial for them to drink breast milk?
I don't see why not. Would everybody do it? No, but I'd say it's probably similar to kombucha, right? You get all that good bacteria.
Something to look
so
into.
Interesting. I know. Well, and that's why I'm so excited about this episode, because we're talking about different benefits of breast milk beyond feeding too. So do you have any examples of ways that families can use breast milk outside of actually feeding?
Yeah, absolutely. It's my mom to mom advice. I always say to my clients, not my lactation consultant advice. But I personally use it for a lot of infections. Like I've used it for pink eye in my daughter, and it like healed itself within 24 hours. I've used it on ear infections for my kids that also healed themselves. Because again, that good bacteria really just helps fight off the bad, which is great. It's also awesome for skin. I've put it directly on like diaper rash and then leave their little batuta open to air, and it like fixes like that, which is so cool. Also, people will make like milk baths. So I always tell people never to pump and dump. If people tell you that, like always save it for something else. Because if you're not feeling comfortable with your baby drinking your milk for whatever reason, save it for a milk bath, because it's great for their skin and it's great for ours. I even had hives postpartum with my second and did a milk bath, and it was significantly better.
So interesting. Let's circle back to the ear infections and the eye piece as well. And I'll admit I did this for my kids too. So I'm so excited that someone had told me about that when my kids were babies. But logistically, how do you do that? Are you just like dangling and putting a drop in their eye? How do you get it into their ear? How do you logistically do that?
Depends what kind of mom you are, Britt. I personally am the mom that would just squirt it on my kid's butt or in their eye, whatever. But I've also seen people like hand express onto a spoon and suck it up with a syringe and then put drops in their eyes and ears. So,
That's easy.
Yeah.
Easy enough.
At least you know it goes where you want it to go and not just all over. So
Is there anything you would not want to use breast milk for?
not off the top of my head. I feel like it's an easy fix for a lot of things.
Have you ever used it for like wounds?
Not like a deep wound, which I'm going to knock on wood because thankfully none of my children have had anything like that or myself. But I wouldn't see why not. I think it would depend on the size of the wound, but
I'm almost thinking C-section scarring, something like that. If
actually,
it could be healing for that.
On that topic, yeah, as long as things are closed and there's no like actual innards showing, I wouldn't see why not. And I've heard a lot of people use it on C-section scars and stretch marks, and that significantly helps heal those things as well.
This
Well,
is
it's
why
not
it's
going to
called
hurt
liquid
it.
gold.
So there you go. Right. You might as well try, right?
And I'm like, a little postpartum tip. I'm like, I've been putting it on my face as a moisturizer, and everyone's like, oh, you look so energized. I'm like, great, thanks. I got 2 hours of sleep.
So how much excess do you have in your freezer right now? Because I'm well past the breastfeeding years. And
Yeah, right.
Actually, kind of on that topic, and this is really a little bit out there, but I've heard that bodybuilders will actually purchase breast milk to help them with muscle gain. Have you heard of this? Is this true?
I have heard of it, never experienced it myself. But I've seen it all over social media that moms will sell their breast milk. And I think there was even a documentary recently about bodybuilders drinking or looking for breast milk for this. And I don't see why not. It has a lot of protein and fat, and all the good ones.
What transfers to breast milk? So obviously you mentioned dumping, especially I'm assuming most people talk about what that would be with alcohol. So what transfers to breast milk regarding alcohol, medications, food that the mom is eating that might affect the baby? What transfers?
I honestly would think anything that goes into our bloodstream, so diet, medications, alcohol, you name it, would most times go into breast milk at some sort of fraction. So it wouldn't be always at the same level, but it's same with like in our placenta during pregnancy. Like there's only certain medications and things that we can take because you'll hear it crosses the placenta XYZ. And same into breast milk. So there's actually a lot of resources out there. So a lot of times moms will send me like, hey, can I take this medication, or what's safe for breastfeeding? And there's a resource out there that will show you the studies that have been done that show like how much of the medications and what's safe and what's not, which is really great.
That's always helpful to kind of have a little bit more of a guideline where people can not just wonder. So
Do you know what the resource is? Because I remember there was like an app or a website that my lactation consultant had told me about with that. Because there's some medications that I know like women are, I don't know if I should be taking this or I should be dumping or whatever. So do you remember the source of that?
For medications or for alcohol?
For anything.
So I use LactMed.
Yeah.
Med. It's kind of like PubMed.
Okay.
From the National Institute of Health.
Okay.
From NIH.
Yeah,
So
we might want to put that in the show notes because I know I looked that up when I had babies, and that was pretty helpful just for peace of mind too. And that way moms can look it up.
So we talked about what transfers to breast milk. This makes me also think about donated breast milk. So obviously there are some situations where someone might want to get donated milk, whether they're not producing enough themselves or they can't breastfeed for whatever reason. So what are pros and cons of receiving donated breast milk? Should a woman do that, or what should she consider?
Sure. I think that donated breast milk is the second best option, right? If our own breast milk is number 1, donated would be 2, and then obviously formula if they need to eat. So kind of going down the line, there is like pasteurized donor milk from a milk bank. So that would probably be your number 1 option for safety because all those moms are screened by the milk bank. They have to do all sorts of testing. They have to get signed off from their own physician, which is interesting to think about. So they do a whole background check, a lifestyle check, things like that to make sure that the milk is safe. They also make sure that they're not on like certain medications and things like that. And then all the milk that's donated to the bank is essentially like dumped in a big vat and pasteurized. So it kills off any harmful bacteria that could be in there. The only downfall that some people are worried about with donor milk is that it loses some of its, you know, bang for a buck, I always say. It loses some fat, protein, calories, which could potentially be true, but majority of it is good.
Does it affect the like antibody level?
It could, depending on the way that it was pasteurized. Sometimes it would kill that off, but I think most times a good amount stays in. And again, still would be more than formula, because if you think formula doesn't have any of that immune support.
Yeah. So what other benefits are there to donate or to receiving donated breast milk?
So donor milk is great for like if we have low supply and our babies want to eat. And like I said, even with my journey, I was hell bent on giving my baby breast milk no matter what that looked like. So if I needed to supplement, I would have definitely sought out some donor milk. And if getting from a milk bank, which in our local area, St. Vincent and St. Elizabeth's are hubs where you can get donor milk. If that's not an option for you, I have a lot of moms that will donate milk to other moms, in which that's really to each mom up to their discretion, whether they feel comfortable using that or not. If you have like a trusted friend and you know their lifestyle and you're comfy with that, great. Otherwise, I've seen a lot of moms that will just do like a quick questionnaire, like, hey, are you on any meds, any certain diet that I should know about? And if you feel comfy with that and would rather feed your baby donor milk than formula, then if that feels good to you, do that.
Do you know, does it cost anything to get milk from a like you said, it's from St. Vincent's and stuff like that? Does that cost anything to a
Yeah,
mom?
I believe it's, and don't quote me on this, I haven't looked at it in a minute, but I want to say it's kind of pricey, like $1 an ounce. But I've heard of some not formula companies, insurance companies helping to cover the cost, especially for like NICU babies or medically complicated babies. So it's definitely something to look into, and I would just call the bank directly to see what their protocol is.
Taking it the next step further, when should you start supplementing with formula?
If you have to.
If you have to, and obviously like no shame because our babies need to eat, right? So when you are noticing like a decrease in diapers, and we'll talk about that in newborn feeding, what to watch for to know that our babies are fed well. But if there's any concerns with diapers or weight gain, or mom's supply, things like that, or if they're unable to directly nurse and you're pumping and just not making enough to feed them yet, those are always great reasons to supplement.
I do know, like, a lot of moms kind of freak out when their baby's a little older, or when they feel like they're not producing as much. I just remember, or like their breasts aren't as heavy and that sort of thing, but they still produce enough. I feel like there's kind of I don't know, like a misconception or something like that, a confusion behind that. Do you know what I'm talking about?
That you should
like,
feel full.
yeah, you should feel full, or like baby's not getting enough. They're not latched as long, What have you seen with that?
For sure. And it's normal to have your breasts not fill up every single time. Like you always see moms in the beginning, like, okay, touching each boob, like which one did I feed off last time? It does not feel like that forever. So you can't always use that as a good indicator, which is a blessing, right? We wouldn't want to be engorged for our entire breastfeeding journey. So what a wonderful gift that is that we don't experience that. So don't be concerned. Like if you know that your baby has great weight gain, great output, I wouldn't be concerned if your breast feels soft.
So one final question is, does breast milk expire? Let's start with that.
Technically, yes. If you look at like the CDC guidelines, they say it's good in the fridge for up to like 5 days, in the freezer above for like 6 months, and in a deep chest freezer for a year. And again, my mom to mom advice is use your discretion. I would never use quote unquote expired year over like, or expired milk over a year for like a newborn or a little fresh infant, just because the reason why it technically expires is they say it loses nutritional value over time. So I would definitely never use that for a little new guy. But if you have an older toddler who would just drink your milk and you don't want to waste it, why not?
Yeah. Okay, cool. So the other pieces that you talked about, like the ear infections, eye infections, things like that, can you use it if it's over a year old then?
Sure. I don't see why not.
Sure. Okay. Is there anything else that you want to tell us about breast milk, like long-term benefits, anything else?
Yeah, absolutely. So we always hear about the great benefits of feeding breast milk to our babies, like decreased risk of obesity, diabetes, asthma, and just overall health. But there's also benefits to us too, which is really cool. decreased risk of reproductive cancers, type 2 diabetes, heart disease, things like that. So it's nice to know that all of our hard work, it pays off for us too. And also hormonal. There's so many great hormonal benefits to breastfeeding. It's linked to decreasing risk for like postpartum mood disorders, which is really important. And it also helps increase our oxytocin levels, which is great for bonding. So anybody that, wants to breastfeed, and it's a great bonding experience, if not anything else.
Wow. Liquid gold right there.
Liquid gold.
And just so many benefits for the baby and the mom. So thank you so much for sharing your knowledge with us, Abby.
Thank you.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.